Did you know that the female reproductive system contains an organ with over 8,000 nerve endings, more than anywhere else in the human body? Yet, comprehensive education about female anatomy remains surprisingly limited. Today, we're changing that. This is science-based education everyone deserves to know. Welcome to evidence-based reproductive health education. Whether you're a student, educator, or simply curious about human biology, understanding the female reproductive system is essential knowledge. Today, we'll explore anatomy, physiology, and the incredible complexity of female sexual health, all grounded in peer-reviewed medical research. Let's begin with external anatomy, collectively called the vulva. Many people confuse the terms vulva and vagina, but they're distinct structures. The vulva includes several components: the mons pubis, labia majora, labia minora, clitoris, and the vaginal opening. Each structure serves specific biological functions. The clitoris is particularly remarkable. This small organ contains approximately 8,000 nerve endings and is the only human organ designed purely for pleasure. But what you see externally, the glans, is just the tip. The clitoris actually extends internally with two legs called crura and two bulbs of erectile tissue that surround the vaginal opening. The entire structure is about 9 to 11 centimeters long. The labia, both outer and inner lips, vary dramatically in appearance from person to person. This natural variation is completely normal. These structures protect the vaginal and urethral openings and contain numerous nerve endings that contribute to sexual sensation. Moving internally, the reproductive system includes the vagina, cervix, uterus, fallopian tubes, and ovaries. The vagina is a muscular canal approximately 7 to 10 centimeters long, though it expands during arousal and childbirth. The vaginal walls contain rugae, folds that allow for this expansion. The vagina maintains a slightly acidic pH between 3.8 and 4.5, which helps protect against infections. The cervix connects the vagina to the uterus. It produces mucus that changes consistency throughout the menstrual cycle, becoming clear and stretchy during ovulation to facilitate sperm transport. The uterus is a pear-shaped organ with powerful muscular walls. During pregnancy, it expands to accommodate a growing fetus, then contracts powerfully during labor. The fallopian tubes extend from the uterus toward the ovaries. Fertilization typically occurs here. The tubes contain tiny hair-like structures called cilia that help transport eggs. The ovaries produce eggs and hormones, including estrogen and progesterone. At birth, ovaries contain approximately 1 to 2 million eggs, though only about 300 to 400 will be released during a person's reproductive years. The menstrual cycle typically lasts 21 to 35 days, with 28 days being average. It's controlled by a complex hormonal feedback system involving the brain and ovaries. During the follicular phase, follicle-stimulating hormone stimulates egg development. Estrogen levels rise, causing the uterine lining to thicken. Ovulation occurs mid-cycle when a surge in luteinizing hormone triggers egg release. Some people experience mild cramping or spotting during ovulation. The luteal phase follows ovulation. The empty follicle becomes the corpus luteum, producing progesterone to prepare the uterine lining for potential pregnancy. If pregnancy doesn't occur, hormone levels drop, triggering menstruation, the shedding of the uterine lining. Menstrual flow typically lasts 3 to 7 days and involves 30 to 80 milliliters of blood and tissue. Now let's discuss sexual arousal and response. Understanding this process is important for both education and health. Sexual arousal involves both psychological and physiological responses. The brain processes sensory information and emotional context, triggering the release of neurotransmitters and hormones. Blood flow increases to the genital area, a process called vasocongestion. The clitoris becomes engorged, the vaginal walls produce lubrication, and the labia may darken in color. The vagina elongates and expands in what's called the tenting effect. Heart rate and blood pressure increase. Breathing becomes deeper and faster. Muscles throughout the body may experience increased tension, a phenomenon called myotonia. The sexual response cycle, first described by researchers Masters and Johnson, includes 4 phases: excitement, plateau, orgasm, and resolution. However, it's important to note that not everyone linearly experiences these phases. Orgasm involves rhythmic contractions of the pelvic floor muscles, uterus, and vagina, typically occurring at intervals of 0.8 seconds. The brain releases oxytocin and dopamine, creating feelings of pleasure and bonding. Research shows that orgasms can result from various types of stimulation. Clitoral stimulation is most common, but some individuals also experience pleasure from vaginal stimulation, cervical stimulation, or stimulation of other erogenous zones, like the breasts or neck. Brain imaging studies reveal that orgasm activates numerous brain regions, including the sensory cortex, motor areas, and reward centers. Interestingly, it also deactivates the amygdala, which is associated with fear and anxiety. Let's address some common myths and misconceptions. First, there is no single normal appearance for vulvas. Natural variation in size, shape, and color is extensive and completely healthy. Second, vaginal lubrication varies based on hormonal levels, hydration, medications, and arousal. Some people naturally produce more or less lubrication, and this can change throughout life. Third, the concept of virginity as determined by an intact hymen is medically inaccurate. The hymen is a thin membrane that varies greatly in appearance and may be stretched or torn through various non-sexual activities, or may remain intact even after intercourse. Reproductive health involves more than anatomy. Regular gynecological care is essential. This includes pelvic exams, pap smears to screen for cervical cancer, and testing for sexually transmitted infections. Self-examination can help you become familiar with your own anatomy and notice any changes. Knowing what's normal for you makes it easier to identify potential concerns. Common health issues include bacterial vaginosis, yeast infections, urinary tract infections, endometriosis, polycystic ovary syndrome, and uterine fibroids. Each has distinct symptoms and treatments. Hormonal changes throughout life significantly impact reproductive health. Puberty, pregnancy, postpartum, and menopause all involve major hormonal shifts that affect the reproductive system, mood, energy, and overall health. Sexual health also includes understanding contraception options, which range from barrier methods to hormonal contraceptives to permanent sterilization. Each method has different effectiveness rates, benefits, and side effects. Understanding consent is crucial. Consent must be freely given, reversible, informed, enthusiastic, and specific. It's an ongoing conversation, not a one-time agreement. Many factors influence sexual health and satisfaction, including physical health, mental health, relationship dynamics, stress levels, medications, and past experiences. If you experience persistent pain, discomfort, or concerns about sexual function, consulting a healthcare provider is important. Education about female reproductive health empowers individuals to make informed decisions about their bodies and healthcare. It reduces stigma and shame, improves communication between partners, and promotes early detection of health issues. This information is based on current medical research and consensus from organizations including the World Health Organization, the American College of Obstetricians and Gynecologists, and peer-reviewed scientific literature. Remember, everybody is different. What's normal for one person may differ for another. If you have specific health concerns, always consult with a qualified healthcare provider who can offer personalized medical advice. Thank you for watching this evidence-based educational content. Knowledge is power, and understanding your reproductive health is an essential part of overall wellness. If you found this information valuable, please share it to help spread accurate, science-based health education.